Yeah, I'm Dr. Miner. We are back. We are going to talk today about experts in saving teeth compared to non-experts in saving teeth. We had a patient come and visit us, and during that examination, we found some issues that should be addressed. And when we talked with them about what was going on and what needed to happen, they decided to go see a specialist. We have the report from the specialist here, some good, mostly bad, and we'll go over that. So with this patient, there's what's called internal resorption. And what that is inside the tooth, the body just starts to eat it. And as a comparison, when we look at this dark area here, that's what we consider normal. And then when we look at these two, we can see it more on this one. It's really kind of fuzzy in there, little fuzziness here. And if we take another view at them, again, we can see normal, on this tooth normal, but we see little fuzziness and more fuzziness here. So that's internal resorption. So with the specialist, they wrote their diagnosis here, that there's internal and external resorption. Now the problem with that is internal resorption and external resorption is not a diagnosis. It is a finding, what we consider a finding. Which similar to that would be, say if somebody has colon cancer and they have blood in their stool. That would be a finding, but the actual problem is called cancer. Now on this part, a CBCT is a 3D image. So all they're saying is they saw this, which is very kind of nondescript. You know, there really should be more with this that's said. So with the clinical part, this is good. They talk about the soft tissue, the gums and things like that, but that looks normal. Now with a diagnosis, when it comes to this type of thing, we have two categories. We do a pulpal diagnosis and what we call a periradicular diagnosis. So none of this addresses that. Now I listed here what would be the correct diagnosis of this situation. We have the pulpal diagnosis, which would be irreversible pulpitis. So when that internal resorption happens, the pulp is, like the blood vessels, is irreversibly inflamed, which means it requires treatment. And a periradicular, that means the tissues around the tooth. And all that was normal. Now this is what's troubling, this is the recommendation from the specialist, which is basically do nothing, right? Or wait till it bothers him. So this is just like saying you get a diagnosis of cancer and the doctor says, we're not going to do anything until it's like a stage 3 or stage 4 cancer and it's bothering you. And here's the other issue, right? The specialist says, right, come back if you want in a year, we'll do another 3D image. So again, it's kind of like saying, we'll wait on treating your cancer. You know, maybe in a year you could still be alive, maybe you'll be dead, we don't know. And that's how it is with this resorption. Because the problem with the resorption is we never know at what rate it progresses. It could be fast, it could be slow. It's like with those radiographs I showed, it could be like that for a year or two, and you check it every year, no change, and then the next year you come back, and now it's just completely eating the tooth. With inside the tooth, the body's eating away at it, and if it eats away to where it gets to the outside of the tooth, things have really changed. You know, the tooth really becomes compromised at that point, and maybe some things can be done, but definitely you don't have the options available like there are now, when it could very easily and predictably be treated. Now here's a different patient with the same problem. This is internal resorption. We can see this dark area here in the tooth, so that's where the body is eating it. And at this point, it's probably eaten all the way through to the outside, which that's not good. That is not good. So when it's at this point, this is so much more predictable, so much more treatable, and keep the tooth. So that patient we were showing before that got the advice from the specialist to just wait and watch is such poor advice, because we know this is going to happen. We just don't know when. So here's what should have been recommended by the specialist, is that root canal therapy be done so that we stop that resorption that's going on, because we don't want it to eat its way through to the outside and we save the teeth.